Here's Nicholas Tetra. If you're a student in medicine or if you're simply a doctor, a respiratory therapist, look at the following video coming from a medicine teacher at the Faculty of Medicine of Louisiana State University, LSU in Louisiana, the very world-renowned and very famous Dr. Paul G. Harsh, ultra specialized in hyperbaric medicine. Listen to the simple advice he gives you, and that you will not learn, and I repeat that you will not learn at your university during your studies. We've implemented this with my son Arthur, who drowned and survived, and it removed the brainstorming, it removed the dystonia. We also were able to convince another doctor in the intensive care unit in Toronto, in a Toronto GTA hospital, where another patient of a friend of ours had the dystonia following a big accident, and it worked as well for him. It removed the dystonia or the brainstorming. So a simple gesture like this can make a huge difference in the recovery of your patient and help the state, in this case the government, because most of our healthcare system in Canada is publicly funded, save thousands and thousands of dollars. So please, I'm not a doctor, but we've lived it with Arthur, and it works extremely well. And please listen to the advice of this very famous Faculty of Medicine teacher and researcher, Dr. Paul G. Harsh. Let me know if it works. Thank you. Good day, everyone. Today I have the pleasure and the privilege to be with Dr. Paul G. Harsh, world-famous doctor in hyperbaric medicine, an absolute genius. And I would like him to explain to us, how does normal barics medicine or therapy work?
Normobaric oxygen is using one of the two components of hyperbaric oxygen to give a treatment effect. Oxygen, as we are breathing right now, is what's called a respiratory metabolite. It is used to burn the fat, protein, and sugar that is our fuel for our body. When you elevate oxygen for a limited period of time and take it away, it no longer acts strictly as a respiratory metabolite. It now acts like a drug and has drug-like effects on a lot of our genes. And what it does is cause up and down regulation of these genes, with that the elaboration of proteins, and these are involved in the healing process. And that is how this works. And it can work for anyone, even under normal circumstances, but especially in an injury situation. So what it does is it is most active at injured tissue in our body. And that's what we're using it for. And it's been used. It's been shown to be effective and helpful in acute stroke, in acute traumatic brain injury, and we have used it for many years as an extension of therapy for patients we treated with hyperbaric oxygen for wound care, who were unable to continue in the hospital setting but weren't healed. We would send them home with supplemental oxygen to use a couple times a day, and it's effective.
I've seen it work wonders on our son Arthur, who was suffering from severe dystonia or brainstorming. And since the hospital, Ochsner Hospital, and even in the air ambulance, they've all accepted to use your technique, our son has little or no more dystonia or brainstorming whatsoever. So do you think we should it should become a standard protocol or standard medicine or approach to cure brainstorming or dystonia?
Yes, I do. It's innocuous. It has no toxicity that can be identified. There's no science showing any toxicity. So it's I'm going to say almost 100% harmless, and has great potential upside, as we've now captured on video with a number of patients. You can see it with the little Eden Carlson video, which is online. You can see it with the CBS News piece and the little drowned boy from Morocco, Aden El Jariri. And now we have another mother who has sent me a video of her son who was crushed under a bunch of metal roofing sheets, had a cardiac arrest, and used this to begin resuscitation before they brought him here for hyperbaric oxygen, where he had an even greater effect.
Thank you very, very, very much. It's an absolute honor, privilege to to be with you in New Orleans. And for any patients in Canada and the US, if you want to deal with the most advanced medicine, hyperbaric medicine, there's no one better than Paul G. Harsh. So thank you so much.
My pleasure. Thank you.